Now, this is super important because it is a syndrome. It's not a specific disease. So people say, well, I've got chronic fatigue. It's like, well, what does that actually mean? What symptoms do you have of chronic fatigue? Are you sure it is chronic fatigue and that's actually an appropriate diagnosis? Or is there something else and more to the story? Now, chronic fatigue syndrome, it's going to impact females more than males, but it does impact both. Now, there's going to be a lot of issues that we are going to see with it. Now, you should have had this for 6 months or longer, and you should have ruled out some of the obvious things, which we'll talk about those. But, iron deficiency, blood sugar issues, blood pressure issues, diabetes, and things like that. So now, this is all from a research article called Myalgic Encephalomyelitis, Chronic Fatigue Syndrome, the Biology of a Neglected Disease. So I thought that was interesting that they called it neglected disease, because a lot of people are diagnosed with it. And then from that point on, they kind of feel gaslighted, which we're going to talk about why they feel that way and then what can be done about it. But whenever we look at chronic fatigue syndrome, we see a constellation of symptoms. We see a lot of neurological based issues. So directly neurological impairment, as well as autonomic dysfunction, which once again is neurological. We see gastrointestinal problems. We also get musculoskeletal based issues with the pain and post-exertional malaise. We have respiratory based issues and immune system based issues. Now, one of the things that it says is 95% of myalgic encephalomyelitis or chronic fatigue syndrome patients have worsening of symptoms in the upright position. So when they go from laying or sitting to standing, and that's why when you look at this, you see POTS, which is postural orthostatic tachycardia syndrome. There's a big overlap in the symptoms. So if you've been diagnosed with POTS, you're like, man, this looks just like me. And at the end of the day, there is tremendous overlap. And it's why you can actually use pretty much the same approach to treat POTS as you would chronic fatigue syndrome. Because once again, POTS is a syndrome as well. It is not a specific disease. It's got certain things you're looking for, and that's how you make a diagnosis. Same thing's true with chronic fatigue syndrome. But there's not a defined, this is the only process that occurs to cause it. So we are going to discuss, we saw all of those different systems in the body that it impacts. We're going to look at what actually drives this syndrome and why it is hard to get better. Because a lot of people, if you actually look at that research, they'll say it's 5% of people diagnosed will actually get back to where they were before they had it.